Egg on side appearance of the heart is seen in transposition of great arteries. Egg in cup or egg in shell appearance of the heart is seen in which condition? It's constrictive pericarditis. Boot-shaped heart is seen in which cardiac condition? It's tetralogy of Fallot. Snowman heart or cottage loaf heart is seen in supracardiac TAPVC. This video will provide detailed but easy to follow explanation with lots of mnemonic of 4 different heart conditions. Egg on side or egg on string appearance of the heart is seen in transposition of great arteries. TGA is ventriculoatrial discordance in which the aorta arises from morphologically right ventricle and pulmonary artery arises from the morphologically left ventricle. The pulmonary and systemic circulation functions in parallel rather than in series. In case of TGA, oxygenated pulmonary venous blood returns to the left atrium and left ventricle. Deoxygenated systemic venous blood returns to the right atrium and right ventricle. Deficient oxygen supply to the tissue and excessive right and left ventricular workload. The heart appears globular due to an abnormal convexity of right atrial border and left ventricular enlargement and therefore appears like an egg. The second abnormal finding is narrow vascular pedicle. This is due to stress-induced thymic atrophy. Overcirculation of pulmonary blood flow results in third finding represented as an increased vascular lung markings. Combination of an oval cardiac silhouette and narrow vascular pedicle has been visually described as an egg on string or egg on a side appearance. Egg in a cup appearance. It is seen in constrictive pericarditis. You can remember like egg is constricted in cup, so egg in a cup appearance is seen in a condition called constrictive pericarditis. This is also known as a Pick's disease, is a sequelae of chronic inflammation of the pericardium. Constrictive pericarditis is a condition where the pericardium, the thin membrane that holds the heart in place, becomes stiffer and thicker. Constrictive pericarditis is an inflammatory condition of pericardium. Its etiology includes infection, connective tissue disorders, chest trauma, radiation, and post-cardiac surgery. Loss of elasticity will result in loss of pericardial compliance, impaired ventricular feeling, and reduced stroke volume and cardiac output. Left atrial and right atrial pressure increases as the ventricular feeling is impaired. The atria continuously receive blood and is unable to empty completely to ventricle due to impaired diastolic stretch. There is a diastolic dysfunction. Pericardial calcification in X-ray provides a clue for the diagnosis of constrictive pericarditis. The calcium can be thin and linear and appears as eggshell calcification around the margin of the heart. Typical X-ray chest of the patient with constrictive pericarditis is due to pericardial calcification. Mnemonic to remember is falling boot. Boot-shaped heart is seen in Tetrolagy of Fallot. These are the component of TOF and mnemonic to remember is VSDH. V stands for VSD, S stands for pulmonary stenosis, progressive infundibular, D stands for overriding of aorta or dextroposition of aorta, and H stands for hypertrophy of right ventricle. So first component is pulmonary stenosis or narrowing of right ventricular outflow tract into the pulmonary artery. This could be either narrowing of the valve itself or narrowing of the infundibulum. Either way, this makes it harder for deoxygenated blood to get to the pulmonary circuit. Second component is right ventricular hypertrophy. In response, and this also happens to be the second feature, the myocardium of the right ventricle hypertrophies or gets really thick in order to contract harder and push blood past the stenosis. Third features that large ventricular septal defect, this gap between the ventricles that allow shunting of blood between them. Now in patients with only VSD, no other problems, no pulmonary stenosis, oxygenated blood shunts from left to right side because pressure on the left side is higher than the pressure on the right. But with the patients with tetralogy of Fallot, through right ventricle outflow tract obstruction might block the normal blood flow so much that pressure in the right ventricle has to be really high to get past it. Well, the right-sided pressure means that left-sided pressure of heart actually becomes the path of least resistance and deoxygenated blood shunts from the right side to the left. The fourth and the final feature is that aorta overrides VSD, and this one is super variable. Sometimes the aorta is way over here, is sitting on the top of the septal defect, and sometimes it is more on the left ventricular side. Either way, deoxygenated blood is shunted from right to left and then it flows over to the left ventricle and immediately out. Critical feature of tetralogy of Fallot is the degree of RVOT, that is right ventricular outflow tract obstruction. Right ventricular outflow tract obstruction along with large non-restrictive VSD, so right and left ventricular pressure are equalized and the blood shunts from right to left side and it bypasses the pulmonary bed, which results in cyanosis. This combination of defects result in elevated right ventricular systolic pressure with right ventricular hypertrophy. Right ventricular hypertrophy has resulted in upturned cardiac apex that is positioned to abnormally high above the diaphragm, reduced pulmonary vascularity, oligemia, which is visualized in this X-ray as diminished lung markings, that is increased blackness of the lung field. One of the defect is an overriding of aorta, which along with pulmonary stenosis and a VSD facilitate the shunting of blood away from the pulmonary system. This results in a large aorta. Pulmonary stenosis can also result in a small main pulmonary artery due to reduced blood flow. This finding is depicted on X-ray as an increased concavity of the main pulmonary artery segment. Snowman heart, cottage loaf heart, or a figure of 8 heart is seen in supracardiac TAPVC. Mnemonic to remember is slow falls from the top, from the sky. So snowman heart is seen in supracardiac TAPVR. TAPVR is a cyanotic cardiac defect when the pulmonary veins fail to connect to the left atrium. Pulmonary veins connect directly to one of the systemic veins. There are 4 types of TAPVR: supracardiac, cardiac, infracardiac and mixed. In supracardiac TAPVR, pulmonary veins form an anomalous vein and then it opens into the innominate vein to open into the right atrium. In cardiac TAPVR, pulmonary veins directly open into the coronary sinus, and infracardiac TAPVR, pulmonary veins open into the opening vertical veins through diaphragm into portal veins or a ductus venosus. In a patient of supracardiac TAPVC, without obstruction, cardiomegaly is seen. A characteristic figure of 8 or a snowman appearance or a cottage loaf bread appearance refers to a configuration of heart. Head of the snowman is made up of superior vena cava on right side, vertical vein on the left side and innominate vein on the top. While the body of snowman is the heart, on the right side it is right atrium, on the left side it is left ventricle. I hope you all understood and learnt well. Thank you for watching this video.